Have you ever wondered why you get out of pain very quickly and then weeks go by and then maybe even a month goes by and then you get right back into pain? Well, if so, and if this is you, keep watching. Hey guys, I'm Dr. Josh. Today's episode is going to be all about how to get out of pain and stay out of pain because too many people, once they get out of pain, go back to the things they love and then they get right back into the same problem that they were in. And that is a big issue, especially if you need to train for a goal or if you love to be training or if you just want to live a normal, healthy life. The truth is, getting out of pain can be very, very easy. I know it sounds really harsh to say that right now, especially if you're suffering with some pain, but typically getting out of pain can take anywhere between 2 and 6 weeks depending on the case and what you have going on. The hard part, to be honest, is actually staying out of pain. So most people start here, they get out of pain, they fall down, meaning, and then they do some sort of activity, they get back up to baseline, and then they go back up and they start getting stronger, and then they fall right back down. That can be a real big problem, and it can be really depressing and demoralizing, especially if you keep trying to stretch and ice and do all your strengthening. It can be really difficult. The reason this typically happens is because people get out of pain, they go back to doing all the same things that they're normally doing, and then they forget about the problem and they forget about correcting the problem. So in our care and in clinic, what we do is we teach a pain phase. So when you're in pain, you have to do anti-inflammatory techniques, ice, stretching, compression, anti-inflammatory techniques, as I said, such as laser, maybe some soft tissue, whatever it needs to be. From there, we need to graduate into some sort of rehabilitation, what I call corrective phase or recalibration phase. This is a phase where you're learning how to remove, meaning you're learning how to dial in and change the movements that have caused this problem in the first place. If you don't change this, this is going to be the biggest thing. If you don't change this, you're going to eventually fall right back into pain later in life. And to be honest, this side is pretty easy, meaning pain relief is pretty easy. The hard part where most of your care should actually occur is typically that corrective or that recalibration phase. If you don't spend a bulk amount of time here, you're going to not be able to get back to the training or performance phase, which is phase 3. So pain relief, correct the problem, then get back to training. If you do these all together, and again, it's not like step by step, if you do them all together, you toggle pain relief with training, with corrective care, with mobility, with all these other things, that is how you create an optimal training program. So again, it's not stages of ladders like going up, going up, going up. It's, can you get out of pain first? Once you have dialed the pain back, then can you correct the problem? Can you correct the problem with mobility and enhancing some of your basic strength? And then can you move on safely and slowly? Again, to recap that, pain, correct, train. Once you can do that, you can have a good quality system and a good quality program that enhances your fitness level without or with minimizing the risk of re-injury. So again, if you keep falling in and out of pain, whether it's low back pain, sciatica, a shoulder problem, an elbow problem, a neck problem, it doesn't matter. It all falls within the same realm. And you need to start with a pain stage, correct the problem, then get back into strength training so that you can fix this problem once and for all. So this is how you actually get out of pain and stay out of pain long term. Thanks again for watching. I'll see you guys for the next episode.